All right, thank you for coming here today. We have Dr. Andrew Jensen, family practice physician, and he'll tell us about a career being a doctor. So, but before we begin, let's do a little housekeeping. Make sure you check in so that your teachers know that you are here and not somewhere else. And we have a great question document and evaluation form. We're also going to put this on the chat. So if you can't do the QR code, there's a link on the chat. Be fully present, pay attention, participate actively. Do not play with your phones. Ask questions in the chat. And you can actually turn on your camera if you're comfortable. You're not going to be showing in the recording. And most importantly, do the evaluation right after this event, because the evaluation is your attendance, and that is how we'll able to give you a credit. So that is all. Let's have Dr. Jensen share.
All right, find this thing here for a minute. Review, maybe slideshow. All right, and Julia may have just joined us. Julia, are you Rodriguez? Are you on? Thought I saw her name float by.
Yes, I am. Sorry about that.
Hey guys, so I'll introduce myself and then we'll let Julia introduce herself as well. So this is basically going to be a short presentation on kind of the broad overview of medicine. Can you see the presentation? Probably not. No. All right. So now I have to figure out. Hold on a sec. I have to figure out what I'm sharing so that we can do that correctly. That would be, I see transcripts, view, security, pause, share screen. There we go. Hold on. One participant, multiple participants. So one participant, only the hosts. That's good. Now I just need to figure out where the share button is in this thing. Can anybody, I see the share screen. Oh, there we go. I'm getting there. All right. Did everyone see that a little bit? Yes. Yeah, we're a little far from Hillsborough, but that's okay. Fun pictures. There we go. So I'll introduce myself a little bit. So my name is Andrew Jensen. I'm a family doc here in the Hillsborough area. I moved here in 2019, and I'll tell you more about my history shortly. I have the good fortune of having Julia Rodriguez join us, who knows a lot more about Hillsborough than I do. And so let me have her introduce herself. So we have not practiced this, so we're going to just do a little tag team back and forth.
Hi, everyone. My name is Julia Rodriguez, and I grew up in Hillsborough, so I'm really excited to be here. I'm at the end of my medical school career. I'm about to start residency, and I hope to become a family medicine doctor. So any questions that you guys have about college, how long med school is, anything along those lines, I'm here to help. So yeah.
So we'll explain a little bit about that. She used a few terms there, med school, residency. We're going to talk about what all those mean. But this is a much broader view than medicine as doctors see it. So I want you all to be aware that we're not here to talk about how great it is to be a doctor, although at times that can be great. We're here to tell you that the healthcare field, which is a much broader field, particularly in the United States and getting broader, has a whole lot of options for all kinds of people, whether you're extroverts or introverts or math people or not math people. There's a lot of interesting options within medicine that you might want to consider. So on this picture, by the way, I believe is from Malawi from years ago, which is in Africa. So my journey to medicine, this is a journey because these are the little things you drive around in Malawi, and I spent some time in Africa. So I figured it was part of a journey. I'm going to explain a little bit of that, some of my experience, some of the options that are available in healthcare, some of the benefits, and then like how would you get into healthcare if you wanted to? And then we'll spend a lot of time with questions. If you have questions along the way, put them in the chat. Somebody can read them to me and Julia, and we'll try to address them. I can't see all of your videos, so if you raise your hand, I can't see it all, but maybe Goldie or Catherine can stop us. So my journey, I went to high school. I remember distinctly at the beginning of high school that nobody had told me that you had to do something after high school because they said it's 4 more years of high school. And I was so tired at the beginning of high school. I was like, oh my gosh, I have to do 4 years of high school. That somehow I got through, which was good. And then a lot of people go to college. Most people, I would say, go to college, whether they go directly after high school or after a year or two, they go for 4 years of college roughly. And then during that time, you can learn a lot about yourself. I would argue you can learn a lot about your strengths and your weaknesses. I hope that during college, for those of you who go, that you make some really good friends. I still have lifelong friends from college, and I'm now 25, 30 years out. So that's important to me. It is a great place to learn how to learn. I have kids in high school and they think they know a lot about how to learn, and they know a lot about, gosh, almost everything. It's amazing what they know, but they don't seem to quite know that there's still a lot to learn about how to learn. So I would be a little humble as you go along the way. I happen to do my college in civil engineering and structural engineering, which has nothing to do with medicine, but that's what I was interested in at the time. So I went and did that. After that, I worked for TriMet for a little while. For anyone who's ridden on the light rail going north-south, I worked on that for 6 years, 7 years. And that was interesting and fun. But after a while, I said, I really like working with people. I like spreadsheets, but I don't want to do it forever. I would highly advocate that all of you learn how to use spreadsheets, because you can get a job if you can do spreadsheets. And then I decided, because I liked working with people, I wanted to go and become a doctor, because I had some friends who were doctors. After that, at least if you're going to become a doctor, you end up going to what's called residency. That's some training. In my case, it was 3 years. Sometimes it's 4, sometimes it's 6 or 7, depending upon what you want to do. I currently practice family medicine with Obstetrics. This is a little baby in Malawi or Rwanda getting heated up after delivery. It's good to heat up babies. So, Julia, how did you get here? How did you end up in medicine?
Yeah, I did a lot of volunteering back when I was in high school, working a lot with like the Diabetes Expo in Portland and working with some mobile health vans, including helping basically through Virginia Garcia. And so back in the day, we didn't have access to a lot of interpreters. So I found myself, I really love reading in Spanish and the Spanish language. So I just used those skills to kind of help in healthcare, and then found role models along the way. Didn't know if I wanted to be a doctor. I worked a lot with nurses and family nurse practitioners, but then ultimately found my passion in medicine and wanted to continue my education. So I decided to become a doctor. But yeah, lots of community service. It's kind of where I found my passion.
So, and then how did you ended up deciding to go to college? How did you manage to make that transition or go through that?
Yeah, so I've always really liked science, and I always kind of had an idea that I'd go to college, but I didn't know what path I wanted. Can you hear me now?
Yeah.
Okay,
Yes.
sorry. I don't know if it was cutting off because it told me
It was, but you're doing okay.
Okay, yeah, I just really liked science, and I knew that I wanted to continue learning. So there was a program through Glencoe High School. I went to Glencoe High School called TRIO, where they basically took us out and like took us to different college campuses. And then I really saw myself learning more, and seeing myself in the campus really helped. And then that's kind of how I went to University of Portland, stayed local since I wanted to be close to my family, and then kind of kept doing community service. But I'm really working with my counselors and working with that TRIO program to get exposure to college campuses.
That's great. I think one of the lessons I would take from that, for those of you who are interested in basically doing anything, taking the initiative, using the school resources, talking to your counselors, you can really enhance your life, and they really typically enjoy working with you. So don't forget to reach out. So let's talk about healthcare in general. There's a lot of options in healthcare. I put a website up there. Mayo is a big kind of academic medical institution over in the Midwest, and they had a list here. So there's all kinds of things. If you think about kind of people getting sick or having trouble, you might think about the paramedic or the fire guy who comes in and helps you out. So that's part of healthcare. There are things like pharmacists, and they are people who specialize in kind of how do these medicines work? How do we get them into the patient? How do we make sure that we're giving them safely? There's pharmacist technicians who help pull them together physically. There's nurses, and there are tons of nurses, lots of nurses and lots of options in nursing. If you've thought at all about healthcare, you should at least think about nursing, because the desire, at least the need for nursing, is huge. I suspect it's going to continue increasing. High school students even have an option to be what's called a certified nursing assistant. At some level, you can kind of, I don't know how many hours it is, but there's a long, I think it's a few months worth of a course. You can be a CNA and then you can get paid. It's not always the most glamorous job in the world, but it's a good entry-level job in a sense of kind of what's out there in the healthcare world. There's mental health. For a lot of people struggle with depression, anxiety, other mental health issues. There's counselors, psychologists, a psychiatrist is a doctor who kind of goes into mental health. You got to think about the lab, right? Somebody's going to draw your blood. You don't think about it. They draw your blood, and the only person you see is the person who drew the blood. Well, that person gave the blood to somebody, and then the blood went somewhere, and then they did something with fancy machines, and it flowed through all of that, and then it showed up in a computer somewhere, and somebody had an answer. So there's tons of people who work in the lab end. They tend to be kind of out of the limelight, but they do a lot of really, really important work. And so if you're less about being in the limelight, but more about kind of just getting things done and working with fancy equipment, then labs, blood banks, that sort of thing are kind of fun. You've all heard about MRIs and CTs and maybe even ultrasound. Those are all what's called classified as imaging, meaning those are pictures of you on the inside. So x-rays, you've all seen x-rays of your skeleton or whatever it is. Those are done by an x-ray technician. And then if you want to go beyond x-ray, you can do things like CT, which is a fancy x-ray, or an MRI, which is even kind of more glamorous. And then there's things like ultrasound, which is, you might be most familiar with if you've ever seen pregnant women getting their kind of babies checked out. They use an ultrasound to look at that. And that provides real time images of things. There's a huge, huge number of people who go into this. OIT, I just read in heart ultrasound, and it said performed by OIT student under the guidance of so-and-so. And I thought, wow, that's cool. OIT is providing a whole course in heart ultrasound. So that was kind of neat. And then there's physicians, they're ones who do surgery, meaning like cutting things up. So they cut into you, or they cut into your head or your heart or your body or whatever it is, take things out, move things around. It's a lot more complicated than that, but that's kind of my ground level take. And then there's physicians who are also, surgeons are physicians. There are physicians who don't do surgery. Those would be, some family docs do some level of surgery. There's a lot of other physicians who run hospitals or who run clinics. You're probably familiar with that. Then there's nurse practitioners. I also mentioned physician's assistants. Those are also providers, as we call them these days, or clinicians, people who can see patients, do some diagnostic work, figure out what's wrong, and give them suggestions on where to go forward. Have I missed anything, Julie? I mean, those are the broad categories. What do you, I mean, there's translators, medical translators.
That's true. And in Oregon, we have, you have to be certified to be a translator. So I think there's like 5 states or something like that, but that's something unique about Oregon.
So if there's any of you who are fortunate enough to have been raised in a 2 or 3 language household and are super fluent in, Spanish, Russian, Thai, Vietnamese, whatever it is, there's a place for you out there. And there's a huge need, there's a huge demand. And interestingly enough, every time we see somebody who doesn't speak the language we speak, whether that's Vietnamese or Spanish or whatever it is, we have a little interpreter on a pole. So it's an iPad mounted, and that person then provides the interpretation. The amazing thing about that person is I have no idea where they are. So if you are a great Spanish speaking medical interpreter here, you could get a job working from home, translating for medical visits across the country. And they would pay you really good money for doing that. And you can kind of do it on your own time and your own hours. So if you have that skill set and you're interested in medicine, yes, it would require some training because there's a process. You can't just kind of flip on the computer and go ahead and talk. But it's one avenue that could even be kind of a side job occasionally along the way. Is that true, Julia? Do you think?
Yeah, definitely. I think that you could make it your career potentially, but I see a lot of people doing it as a side job, but it just, lots of things are changing. But so it's a great career to explore, I think, if you
Yeah,
have.
so imagine being at college, you could work as a food service worker, flipping hamburgers, or you could be sitting back in your dorm room getting paid probably more than the flipping hamburgers and doing meaningful work from your dorm room. So there's a thought.
Yeah, and I did that too, like my last year in college. So you can pick up shifts.
There you go. That's kind of fun. So let's see where we're at. Oh, this is a picture from Malawi. They're very colorful. I just put these in because they're a lot more colorful than the pictures of American clinics. So just kind of fun in that regard. So my experience in medicine, I was a rural family physician in Eastern Oregon for 10 years. If anyone's out been to John Day, it's just north of Burns, about an hour and a half. The reason you've probably been out there is either your parents like to go hunting or you like to go hiking, because not a lot of other people are passing through. And it was fantastic because you get to be involved in the community, you get to know people, you get to work and help with people you know. We still go back and work weekends, and over half the people we see in the hospital are people we know or who were our patients. And that's really kind of a fun, amazing connection to have. Small towns enable you to do that. Rural medicine is hard in the sense that you have to do emergency work and hospital work and obstetrics work, but it's very, very rewarding. And there's certainly a need for that out there. We've done some teaching in Rwanda and Ethiopia. We were in Ethiopia for 4 years before coming here. These are some of our residents, meaning basically our students in Ethiopia. And now we're working in Hillsborough at both the clinic. There's a clinic at the Cornelius Pass and TV Highway intersection, and then the hospital downtown. So let's go to clinic. What do I see in clinic? Meaning like who comes through the door in clinic? And we've been building a clinic, and every clinic has different experiences on who comes through the door. Some clinics are very high-end clinics. Some clinics tend to serve more socioeconomically disadvantaged people. Our clinic is probably kind of in between, a little bit of both. But some simple problems like high blood pressure, which, believe it or not, causes you a lot of problems over the course of your life. Heart problems, meaning people who have heart disease or heart attacks. Lung problems, you can think of kids with asthma or older people who've made the mistake of smoking all their life and are stuck with COPD and now short of breath. People who unfortunately were screening for cancer. There's the end of medicine where you're like, let's take everybody and make sure they don't have cancer. And then occasionally you find somebody and you're like, oh dear, you seem to have cancer, and then pass them along to somebody who can help treat them, we hope. There's also depression and anxiety as a fair component of our practice. And that may be adolescents, that may be young adults, that may be older people. There are also people who've struggled with substance abuse, somehow gotten involved over time with excessive alcohol use, excessive marijuana use, a variety of things that have substantially impacted their life. I just saw a guy last week who's 28, started drinking when he was 17, and basically cannot stop. And we all think, well, he could just stop. Well, he cannot stop. And so trying to help him get back on his feet, figure out who can help him, and this is kind of going to involve a lot of counseling and a lot of time and a lot of resources. But, looking back, he's kind of lost 10 years of his life, and he needs to find a way to kind of get back on the road, and he's motivated. So it can be very personal in the people you see. Younger people don't wrestle with all the same things. Sometimes it's sports injuries. Sometimes it's, they're doing something and they get cut, or some sort of accident. Anxiety and depression are certainly out there. There's plenty of other issues that younger people struggle with. They just don't come to the doctor as much, I suspect. We do end up doing a fair number of procedures. So you can imagine you have some funny thing growing on your skin, you want it cut out. Well, that's not that hard to do. You kind of clean it up and cut it out. You can do that. And then you send it to the guy with the microscope who looks at it. That's another healthcare person. They look at microscopes and they look at it and they say, aha, this was that. This is basal cell carcinoma or melanoma or some form of cancer, or maybe it's something else, who knows. And then we also do injections and a variety of other little procedures in the clinic, which can be fun. What am I thinking? What are you thinking about, Julia? Am I missing anything that comes to mind for you?
No, I think that's a pretty comprehensive list. I mean, you mentioned you also see like obstetrics, like prenatal women for prenatal care. Yeah. So
Right. No, that's also important. It's true. We all came from somewhere. So your mom was pregnant at some point in time, and hopefully she saw somebody to help take care of you. And lo and behold, you showed up relatively healthy. So we're glad for somebody who helped your mom through all that. The other thing I should say, that clinic for a family doc is probably very different than a clinic for a plastic surgeon or a clinic for an endocrinologist who specializes in diabetes. If you're the sort of person who really, really wants to know a lot about one particular area, gosh, back in the day, I would have said, every single aspect of trains fascinates you, and you really, really need to dive deep into trains or, football or whatever it is. There are areas of medicine where people really, really do dive quite deep into diabetes or heart problems or, neurologic problems like stroke or multiple sclerosis. So if you are the sort of person who would rather not spend a lot of time in the broad world, but really want to focus, there are people we really, really need who work in those areas as well. The hospital is another thing. I'm working hospital nights this week. So I've been working at night, which is a 12-hour shift from 7 to 7. And I just see the people who come through or the people who are already there who are sick. Our hospitals are very full. In case you hadn't noticed, COVID combined with other medical problems is really, really stressing the system. So we have people who get admitted because they have heart attacks or they have heart rhythm problems. We have people who can't breathe. I had a woman 2 nights ago who's having trouble breathing, and that was because of a longstanding emphysema in many cases. Kidney problems. Unfortunately, a lot of people with diabetes who don't control their diabetes end up having kidney problems. You may have parents or grandparents or aunts or uncles who've wrestled with diabetes. One of the risks of that is that if it's not well controlled or not treated over time, you can end up with kidney problems. Substance abuse. Unfortunately, we see a fair number of people in their late 20s and 30s who have gotten involved in, whether it's methamphetamine use or heroin or cocaine use. And, one thing just goes from worse to worse until they end up in the hospital. And then it becomes a bit of a challenging cycle as well. Falls. I put falls on here because you think, well, that's not very important. People fall all the time. Well, that's fine if you are young and healthy and, invincible as you all are. But when your great grandmother or your grandmother is 82 and her bones are very strong and she falls and breaks her hip, then it becomes a problem. And so we got a fair number of older people who've, for no fault of their own, they slip, they fall. Occasionally they're like my father-in-law and they're up on like a 10-foot ladder painting when they shouldn't be painting, and then they fall. But generally it's, some small little thing they do and then they fall and we have to help take care of them. Surgical problems, don't forget surgery. So I'd have you raise your hands, but if any, we probably shouldn't share too personally, but if anyone's had their appendix removed, you've met a surgeon. So it looks like Julia raised your hand. There we go. So that means, your poor little appendix, which is down in the right part of your abdomen there, got inflamed and irritated. And before it bursts, hopefully you went and saw a doctor and they said, oh dear, you have an appendix problem, and somebody takes it out. That's a surgical problem. And it could be as simple as that. It could be as simple as a C-section to help deliver a baby. It could be as complicated as fixing your heart. So there's lots of surgeries out there. I just mentioned obstetrics, helping see women who come in and anticipate delivering a child. And then emergency patients is a whole nother bunch of people too. Oh, so this is a patient that my wife saw. My wife is also a family doc. This is a patient we saw in Ethiopia who ended up having malaria. It's an infection. We don't have as many infections in the United States. People don't think about it as much, except in times of COVID, right? So now we all think about infections all the time. I'm not wearing my mask because I'm at home, but if you saw Julia or I at work, we would be wearing our masks for 8 or 10 hours a day. And that's because of infection. So infection is a really common cause nowadays, obviously, of seeing people or people being concerned. A few years ago, that wouldn't have been the case in the United States as much. Certainly you saw people with flu. You'll see people with other infections. Viral infections are common, but COVID, of course, has changed the entire game. And believe it or not, there are people who specialize in things like infections. I hadn't mentioned that, but there are people who specialize in that. So if you like little bacteria and bugs, there is a career for you. I'd say one of the reasons I enjoy medicine is you do get to help people when times are difficult. So they come in and they've had an accident, or they've fallen at home and now they can't live at home alone. Or in the clinic, I'll see them after they've been in the hospital for a day or a week or however long it is, and they're wrestling with the problems that came out of that. You get to see people when they're really wrestling with depression or anxiety. I have a number of people who've been depressed for quite a while, and it's really hard to reach people who struggle with depression and anxiety when it's been there for a long time, and some of the easy steps haven't worked as well as we would have liked. So in many respects, I see kind of people who enter medicine as those who are called to love alongside people who are suffering. We don't always relieve suffering. And my wife would advocate strongly that our primary job is to be with people in the midst of their suffering. And then if we can help them, that's great. But just to be there and be a presence with them is really, really, really both important, but even more so, it's a bit of a calling. It's yeah, it's almost mystical. It can verge on holy. It's a really special time if you get a chance to do that. Now, occasionally we get to hang out with people when times are good. So it could be when they deliver a baby and everybody's happy, which is great. I helped with that last weekend, or was it the weekend before? Somewhere around there. People feel better after surgery, so they get their appendix taken out and they come back and they're happy to be feeling back to normal or doing better. Or you're simply there to bring hope and say, hey, look, I have met a lot of people who are on this journey, and there is some light at the end of the tunnel. It may take time, but we just need to get there. And so being able to kind of testify to that to people and share that, yes, things can get better, it's just going to take us a while, can be an important part of that. How about you, Julia? What do you enjoy in medicine? Anything in particular?
Yeah, I definitely like the idea of forming lifelong relationships with patients and like with community partners. I really enjoy um, the idea of doing a lot of community outreach and doing like mobile, not like mobile healthcare, but I like going out to the migrant camps and working with agricultural workers at their job site, and just being a part of like equitable care. And yeah, it's exciting to be able to do that in the future.
Julia points out a good thing. I mean, most of what I've talked about is clinic and hospital. And the truth of the matter is that that's the framework that most of medicine has been developed in. You, the patient, come to me, the doctor, in the clinic or the hospital. You generally don't come to the hospital because you want to. So that's, you don't have much of a choice. Typically, you're super sick. But the clinic, we expect you to come. And that doesn't always work. So over the course of the last year and a half, you may have realized, or you may even have participated in the fact that now we're allowing people to call in by phone and we can talk to them by phone, or they're calling by smartphone and we can do a video visit. Those are all ways that we perhaps can do a better job. At our training program here, we're trying to work on partnering with a homeless outreach mission in Portland so that we could find ways to meet people where they're at and go and say, hey, how can I help you provide healthcare, because help you with your healthcare, because you don't have a job and you don't have transport, and trying to schedule to come to my clinic at 9:10 on a Monday morning is, that's fine and good if you got a job and you got a warm house to sit in and you can get up in the morning, take a shower and be on your way. But if you're like crawling out of a tent at 7 o'clock and you didn't sleep very well, and the guy next door has been kind of yelling all night long, trying to get to the doctor's office and look half presentable at 9:10, just isn't going to happen. So through no fault of anybody's own. So then if there are ways we can reach out to people and provide some care that's helpful, as Julia mentioned, whether that's going out to farm workers who, they don't have time to go to the clinic. They got work to do. They got an obligation to their employer. They have an obligation to their fellow coworkers. Nobody gave them a day off, paid leave to go wander down to the doctor and hang out and ask for some Tylenol. They got, by the time they want to see a doctor, they're often more sick than they should be. And that's, simply kind of a consequence of some of the inequality we have in our system. So being able to reach out and do that, it would be fabulous. All right, let's go. Other benefits of working in healthcare. I know this is hard for you in high school, but believe it or not, learning is really fun over time. So I don't learn very well at this point in time in a classroom. I don't learn very well in a lecture setting, but I learn really well when there's somebody sitting in front of me and I have no idea what to do. So somebody comes in and says, well, I've got this problem and I have a vague idea of what the problem is, but I can't remember the latest or the greatest treatment or the how to diagnose it. So then right then and there, I do some learning. And that is one of the best ways to learn. So I'm not learning about, some Krebs cycle that my chemistry teacher is teaching me, all of which is very important, and I encourage you to study it. But I'm learning about this person in front of me and how to help them with their alcohol addiction. And what are my options and where do I go from here? So it is, you're not simply making widgets day in, day out, sitting on a line. You're constantly being challenged to learn and grow. And I think that's one of the most attractive and exciting parts of this job. You generally get to work with good people because people who go into healthcare really generally care about other people. We all get worked and battered down over time, so we're not all perfect, but you generally do get to work with good people, which is nice. There's almost always a job, and I guess, high school, Hillsborough School District is all about getting a job at some point. And I think that's good because all the parents want you to have jobs and be successful and move out at some point. Most of the parents want you to move out. And so in order to do that, believe it or not, you have to pay rent, pay utilities, take care of your family. And that generally entails getting a job. So there is a fair amount of job security in healthcare in the sense that it's a broad field. And there are lots of different jobs. One of the reasons I mentioned nurses so much is that you think of nurses as taking care of patients in the hospital, and that's true. But there are lots of jobs that nurses can do beyond that. There are nurse educators, there are nurses in assisted living homes, there are nurses in more nursing homes, there are nurses at schools, there are nurses at all kinds of areas of society. So that's, if you have a job where all you can do is make, a small little widget and that widget is all you make, your job security is depending upon how many widgets get sold. But if you're a nurse and you can do all kinds of different things and one job isn't as fun as you'd like it to be, or you'd like a different job, there's lots of options out there. And I would say most of these jobs are very financially solid, whether you're a nurse, you're an ultrasound person, whether you're a lab tech, whether you're a doctor, all of these jobs pay generally quite well. Doctors, of course, classically being paid some of the most. Julia, what do you think? Any other benefits? I'm sure there's lots of other benefits, but.
Yeah, just lots, but being an advocate and you can be involved in policy in the future. If that's, you want to make changes, we're always working. Healthcare's changing, so lots of opportunities to just get involved, I think, and be a leader.
That is true. There's a lot of leadership opportunities. I should point out too that healthcare in the United States is not healthcare in the world. If you were in healthcare in Canada or Australia or Europe, the problems you would face are different. The leadership, the policy issues are different. I happen to like kind of being aware of that and being aware of that and realizing that, our system is not the only one out there. So sometimes learning from other places, learning from other systems, and then pushing for change, despite a very, very difficult thing to do, is an important part of being in this. So your job is, where do you want to go from here? Most of you probably just want to be done with this talk, which is fine. I understand we're running along. We got plenty of time for questions and we're going to get there. So start thinking about your questions, put them in the chat. If you're really, really brave, I'd love to see your face and have you ask in person. That's fine, but you can submit them by chat. If you don't want to turn on your video, you can talk. That's perfectly fine. But you do need to think a little into the future. Like, what do I really enjoy? What might I enjoy about healthcare? What could I consider doing? My gosh, I'm squeamish around blood. I could never go into healthcare. We can address those questions. I can't say I ever saw much blood before going into healthcare when I was working on trains with TriMet. So there are different ways to do it. But it's important to think about things. This is training, again, in Ethiopia. I don't take as many pictures here. So that's training to help somebody have a tube down their throat to breathe. So we always are always doing kind of training options within healthcare. So other things to think about. Keeping your eyes open. It's important. What do you like? What excites you? You know, do you like working with other people? If you like working with other people, family medicine is great. Being a nurse is great. If you don't like working with other people, maybe being a person who looks through the microscope or looks at x-rays all day, you know, you get to interact with a few people, but not quite as many people. So that can be nice. Do you like caring for people? Some of you are caring for parents or grandparents or siblings who have medical problems. Do you enjoy doing that? Do you not? My wife spent a lot of time when she was in high school volunteering at local kind of assisted living facilities because she really enjoyed hanging with older people and caring for them. So if you find that, oh yeah, I like caring for people, I like being around other people, then healthcare might be something for you. Who knows? Keep your mind open. We've gone from your eyes to your mind, you know. You're building your future every day. Think about the things that go into this. I know there's a great push for math and science, and that's all very true. I would argue that English, which now they call ELA, English Language Arts, I think. Anyways, the words change all the time. But basically, how you communicate, either written or verbally, is really important. If you can't communicate with people and understand how people are communicating with you, then things like healthcare become difficult. Social sciences, leadership, all of those things are important. But you don't need to know them all at once. You get to learn them along the way a little bit. I mentioned this before, learn how to learn. So again, you all think you know how to learn. You all think you know how to take a test. So did I. I didn't. Okay. Be humble and say, gosh, how am I going to learn how to learn? I had a high school student who I think was a freshman in college, and I saw her at clinic recently, and she said, I said, what was your best class at Century? She said, oh, my best class at Century was this class. It was an AP class she took. She said, the reason for that was because the teacher taught me how to learn, taught me how to take notes, what was important about learning, how to take tests, you know, all those things. And I thought, wow, she's got it. She's figuring out the important things of how to learn. And in general, the more education, the better. I wouldn't hide under a rock and read books the rest of your life. That isn't going to get you super far, but education generally can be helpful. And I think we've talked a little bit about your heart. Your heart is really an important part of being in medicine. I think the emphasis tends to be on science, math, education, reading, all those things. But if you don't cultivate a heart for people and a love of people and a desire to spend time with broken people and walk with them through their suffering, you know, don't go into medicine, don't go into healthcare. You really won't enjoy it. Go, all right, I'm not going to disparage any particular fields, but go into some other fields. Because there are places where they need people who are less interested in that sort of thing. So those are important. The details. Yeah, why don't you tell us about the details, Julia? How would you go about moving forward if you were in college, high school at this point?
Yeah, I think so. Yeah, becoming a doctor can be a long road. So basically, you start with your 4 years of high school, and then most people end up, you know, going into college, whether they go to a 4-year college or they do like a community college, and then they transfer into a 4-year, but you're going to need a bachelor's degree at the end of the day to then apply into med school. And then some people take time off after college. I did before applying into med school, and I did some work for a couple years and then took an exam that I needed to get into school. And then yeah, I'm at my 4th year mark right now in medical school, and the next step is to basically train supervised, taking care of patients supervised, which is what we call residency. But the way that everyone's path's a little different, and I think my path was a little bit different. I guess I could be like a not traditional student, traditional being like you go in a row, right? You like 4 years of high school, 4 years of college, and then you go into med school. It's okay to take time off. But again, medicine is such a broad field that you'll end up finding your passion. You kind of start in biology and science, and some people do other career undergraduate focuses, like, how should I say it, get a college degree in something different, like math or humanities or whatever they really want to study. You don't need to study science in college. You just need to take the classes that are required, the prereqs, right? So yeah, everyone has a different path. And I think the cool part about pursuing science or having an idea that you want to go into healthcare is that based on how you get involved, being like doing, based on how you get involved by whether it be like shadowing someone or doing community service, you're going to start to see people working in their field, and you'll identify with the people that you shadow and realize what route you want to take in medicine. But medical school, becoming a doctor is a long road.
And I would argue that it is a long road, and it's very challenging and difficult at times. But for the most part, I would say people enjoy the journey. If you can't enjoy the journey along the way, and it's 4 years of college, 4 years of medical school, and 3 to 6 years of training, and you hate it along the way, you aren't going to like being a doctor. So like, if you don't enjoy learning and you don't enjoy that sort of stuff, then that's not the road for you. Now, so let's talk about college for a minute. I don't know what they teach you about college. And I'm not, and I would do a lot of research in a sense, but I do think college, whether you do it straight out of high school or whether you do it shortly after high school, provides an incredible foundation to do all kinds of things in the rest of your life. If you end up being 30 and you say, oh, I didn't go to college, but I really want to be a labor and delivery nurse, then when you're 30, you have to figure out how to go do 4 years of college. And it is painful. I have medical assistants who are doing it. So they work all day and then they go home and do 2 or 3 hours of school at night while they've got 2 kids. I mean, I don't know how they do it. It's really, really hard to do a little later on. I admire them. I think it's incredible, but the time to do it is relatively when you're young and free, like free of external commitments. So being, if you're kind of, well, I'm not so sure about this college thing, I would encourage you strongly, talk to your counselor, look and say, what would that foundation of college do for me in the rest of my life? What are the jobs I can or cannot apply for with or without a college degree? And you will find, I suspect, there are a whole lot more jobs, particularly better paying jobs, that are available with a college degree. That's not to say everybody needs to go to college. There are great vocational jobs out there, whether you want to be an aircraft mechanic, whether you want to go into plumbing, whether you want to go into construction. Those are all amazing career options. And if that's something that fits well with who you are and you're really committed to that, I think it's great. I wasn't the sort of person who knew what I wanted to do. So having a college foundation gave me a lot of options in the future. And so that's kind of one of the reasons it works well for me. There are some of you who would be like, oh, I can't afford college. College is really expensive. What am I going to do about that? I would encourage you to sit down with your counselor and say, what are the options? There's a lot of financial aid available, particularly for people whose family incomes are lower. There's a lot of financial aid that can make a lot of sense. There's a lot of difficult questions that you have to answer along the way because you want to make sure you get the right financial aid. But in a sense, if you want to do a career like this, you can't afford not to go to college because you are ruling out all kinds of options. What do you think, Julia? That's only part of the thought, but
no, I completely agree that that's in college. It's a great time to kind of explore your passions, do some community service work, get involved with different things that you're passionate about, and then that kind of helps guide what career you ultimately go into. And like Dr. Jansen said, having a college degree can just make it easier if you want to switch careers in the future because you just have that foundation and you can just go do a little bit more training, and if that's what the field that you want to go into requires.
And just a shout out to those of you who might be considering kind of higher end schools, but are afraid it's expensive. I would ignore the ticket price. It says it's $50,000, $60,000, $70,000 a year. Forget it. Ignore the ticket price. Find a way to make the application. Find a way to submit for financial aid, and then make your decisions. Don't write off anything on the front end. Particularly the super high-end schools, they have a lot of money. And if your family is not making a lot of money, they're just going to say, please come. We'd like to have you for free. I have a friend, he sent 2 kids to a really top-notch college. He was a teacher. He didn't pay a thing. His kids went there for all 4 years, got fantastic degrees. They even gave him a little stipend, extra money to go on field trips. I mean, like there are resources out there. So don't just write things off because they are super expensive on the front end. At some point you need to make a practical decision. At some point you need to say, is this worth it? Can we do this? But there are financial aid options out there. If you're able to be creative and think about it. And I see far too many kids who are really smart, really talented, but on the front end, they say, oh, I better not apply to that college. I better go to the community college. And that college would have been happy to give them $50,000 a year to come. And they didn't even know it. So this won't work out for everybody, but there may be 1 or 2 of you out there for whom it is a challenge. And I would consider, how do you set that aside for a little while. And then when they finally say, this is what it's going to cost, you can make some real decisions. All right, so here we go. My summary of things. Healthcare is different, lots of options. There could be a place for you. There's lots of places. I don't know what percentage of the American economy healthcare makes up but it's about 15% of the dollars in the American economy, which is way too much, I would argue. It should be a lot less, but it is what it is. And it is growing because people are getting older. And as we get older, we have more medical problems. So it is a growing field. Keep your eyes open, keep your mind open, keep your heart open. Remember who you are, and your character is really, really important. If you have questions, here's my email. Feel free to email me. I'd be happy to write back to you. We used to have options where you could come and shadow and follow along. COVID, unfortunately, has made that significantly more difficult. I don't know what the current roles are, but I'd be more than happy to talk to anybody, exchange emails, answer questions, do whatever needs to do, or bring other people in. If you guys are like, you're a nice guy, but you're kind of old, you've been doing this for a while, and I really need to find somebody like Julia or somebody else who's kind of closer to me, I can help find somebody. We have other people who have different journeys and different paths, and there's a way we can connect you with them. So I'd be happy to do that. Julia, any closing thoughts? And then we're going to go into questions, people. So I'm hoping there's some questions.
No, I agree with, I paid for my school with like full financial aid, and I went to UP, which is a private school. And sometimes private schools have a little bit more flexibility with how they divide their resources. So just keep that in mind.
That's true. Actually, that's really a good point, because I have met people who are like, well, I can only go to a state school or a public school because it's cheaper. And then sometimes you find out, oh, if I apply to the private school and the private school has a lot of money to give for financial aid, holy smoke, it's cheaper than the public school. So that's really, really a good point. All right, so now we're going to turn to questions. I'm going to stop this. I think I'm done with that particular thing. We're going to go stop sharing, which is good. We'll go back to this. There's probably 15 or 20 of you in there, plus an 8th grade AVID class. I don't know how many people in the 8th grade AVID class are actually watching, but we're glad to have you. It's not too early to start thinking about things, just to know what options are out there. Maybe some of you even have parents or friends or family or siblings in the healthcare field, and you've seen some neat things there. Feel free to share that as well. So let's see, there's a chat. Let's see, what are our questions in the chat? Anything here?
Yeah, I think you answered some of them, but
oh yeah, there was some question about how we ended up Malawi and Ethiopia. So just my wife has always wanted to work overseas. She worked in Kenya, Zambia, and in fact, she's an interesting study because she was at college and down in California. And at the very end, she had an opportunity through a doctor she knew who was working as a missionary doctor in Zambia. So she left college for 3 or 4 months and went and lived in rural Zambia, which is out in the middle of nowhere, and had an amazing experience, and really caused her to be committed to kind of caring for people and working with particularly underserved people. And so we ended up doing that. And similarly, going to Ethiopia, we knew we wanted to serve overseas. And so we found an opportunity to go there for 4 years and live there and do some teaching. Somebody asked what it looks like day to day. I don't know, Julia, what does it look like day to day from your perspective?
Yeah, I feel like it's different based on what type of specialty you have, whether you're a family medicine doctor, whether you're like training or you're a medical student, because we kind of have rotations as students and as training doctors. We have rotations. So 2 weeks could be like in the hospital, and then 2 weeks could be in clinic. And then if you further specialize, it's different. But for me, it's like 2 to 4 week rotations in different specialties in medicine. So pretty long days depending on whether you're in the hospital. But in clinic, it's like an 8 to 5 mostly.
I would say that one of the things I like about going is that oftentimes I know some of what I'm going to encounter, but there are other times when I at the end of the day, I'm like, wow, I never would have thought I ran into, I would have helped this woman wrestling with, cutting and her suicidal thoughts. I never would have thought I would have helped this older person kind of wrestling with the challenges of losing their memory, or somebody helping care for their husband as he's losing his memory, or somebody excited about having a baby but also struggling with the fact that she has 2 crazy little kids at home already and wondering how she's going to get through it all. The variety of things that we see and the chances we get to be with people alongside their lives is very humbling. So that's part of our days. What high school courses would you found for the application to be most important, or for occupation? Julia, what do you think?
I really think that all of them prepare you. I mean, I loved anatomy and I continue to love all my anatomy courses. I'm a visual learner, but I think that all the courses have helped me in different ways. I was even going to University of Portland. I was like, why do I need to take theology, which is a special field and not related to science, but it is related it just taught me different skills and ways to look at the world or a problem. So I think everything prepares you. And there's some courses that prepare you more for certain tests, but I think I can't pinpoint one course that helped me more.
But Julia's right. There are certain tests that are considered kind of part of the process. There's something called a medical entrance exam called an MCAT, and you have to have taken biology and chemistry and physics to get through all that. But that's all actually pretty clearly outlined in the road to going into medicine. So all those things, are all fairly clearly outlined. Somebody asked if would you go straight to becoming a doctor? I don't know. My wife went straight to becoming a doctor. I think there's some value to spending some time off. I think you probably can get distracted. And if you get distracted enough, and you end up in another career that you love, well, maybe that's great too. Who knows? Who knows? The 8th graders got great questions here. How much do you earn? What's a monthly salary? I love it. That's a good question. So I will tell you that ranges quite dramatically depending upon what you do in healthcare. So and it almost is directly related to how much education you have. If you get into this straight out of high school as a certified nursing assistant, you're going to make a little more than minimum wage, if I were to guess. If you're going to be a nurse, depending upon what sort of nurse you are, you're going to make, if I were guessing, $60,000 to $90,000 a year. If you're a traveling nurse during COVID, because everybody needs nurses and they're desperate, you're going to earn $100+ an hour. It just depends upon where you go. If you're a physical therapist, you might earn 70 to 90 to $100,000 a year, depending on. We forgot to mention physical therapists, but they're important. They like help you recover from injuries and help you walk and things like that. If you're a doctor, you might earn, $180,000 a year. You might earn $200,000 a year. If you're a neurosurgeon, you might earn $500,000 a year. I don't know. I'm not a neurosurgeon, but people get paid really well in medicine. I think doctors do complain about things, but in general, doctors don't have a whole lot of grounds for complaining. We only complain because we compare ourselves to the neurosurgeons or the heart doctors who make even more. It is important though. I mean, the important part is that you get paid well enough to put a roof over your head, to take care of your family, to take care of your kids. And there's an obligation in there to be a part and to take care of your community as well. Because the community has really given you much of what you have. What would you have done differently? What's my favorite procedure? Let's see, Vincent DeBolt. What's my favorite procedure? I used to like doing colonoscopies out in John Day. For 10 years, I did colonoscopies, which is where you take a camera and you kind of wander up looking through somebody's GI tract for things. I used to enjoy that. That was fun. I like doing C-sections. I do C-sections now. And that's fun because you get to deliver a baby who was having trouble otherwise. Those are fun. Even just sewing like people's cuts up can be really, really fun because it's a chance to talk to people or help them out and kind of interact while you're doing that. So procedures can be really, it really can be very fun actually. And if you had to make the decision again, would you have done, how would you have changed? What would you have done differently? I don't know. You know, lots of things come into life, and so you have to roll with it. And I don't know that I would have done a lot of things differently. Doesn't matter where you went to pre-med. All right, Julia, give me your take on this.
Pre-med, like in
college.
Yeah. I don't necessarily think it matters. I feel like I was lucky to go to a school that had a pretty good research program already set up. I didn't really do a lot of research, so I did more community service and other things that I was passionate about in college. So I think as long as you do your prereqs and you try to do well in your science courses, I don't think it really matters.
So I'll give you my take on this. I think to some extent what Julia said is true. I don't know what the real truth is here, but when I was out in John Day, I saw far too many kids who just said, I'm going to go to Central Oregon Community College or Treasure Valley Community College. And you end up going there. And I'm not saying that they don't provide a decent education. They probably do. But I can tell you in the admission process, if you're applying and you've gone from a rigorous school where there's some academic, where it's demanding academically, and you've gotten A's and B's, and then somebody else is coming from a school where it wasn't very competitive, and their education may have been just as good. They may be just as smart, but I think there is an inherent bias in the system which says, this person went to MIT, this person went to the honors program at University of Oregon, this person went to whatever school it is. I think there is a sense of they maybe are, maybe they have a stronger foundation. So, and the other flip side of that is if you end up in a place that's challenging you, you will spend time with people who will help you grow and help you be challenged. So I think if you're going to a place where you're clearly getting by easily and you're not being very challenged, you need to get to a place where you're going to be challenged. It's not a matter of saving $5,000 or $10,000 a year during undergrad when you're going to end up making a lot of money later on. Spend a little money, take out a few loans if you need to. If you're committed to going on kind of into a deeper medical journey, then it may be worth your while. What do you think, Julia? Am I a little skeptical? Yeah. I don't know, cynical?
No, I think that's looking back now, I guess I did go to a pretty strong a school that had a lot of research and that had a very strong science program. And there were a lot of people from my school that ended up going into med school. So looking back, that is true. And I'm really grateful for that. But they do look at more of those rigorous programs.
Yeah, I have a friend who I met recently who went to another college around here that I really admire, and I certainly admire him. I think he's an amazing guy, incredibly talented, incredibly passionate, a fantastic heart. But I think because his school didn't have a track record of sending people into medicine, it was really hard for him. And I think the interviewers at OHSU probably had some preconceptions. Oh, he comes from a school that doesn't have a long record of sending people to medical school. And therefore, it's not always about who you are. It's about what I see in front of me. And I've got somebody from school A and school B, and I've heard a lot about school A. Boom. I hate to tell you, it's not always, a deeply personal process. So it can matter. Are you guys ever uncomfortable at the sight of blood? Julia?
I think one time I used to be a scribe, so basically I do notes for providers in the emergency room. And the first time I saw them place like more like a permanent IV, which is just access to your veins, I did feel a little queasy, but that was like my only experience. And then after you see blood over and over and over, it just becomes second nature. So, and I think I had an 8 that day, so I was just multiple things going on, or it was new to me.
So, and I would point out that you just get used to it. I mean, I wouldn't ever let that be a barrier to you. You get used to all kinds of things. So don't let that be a barrier for you. I know that's kind of it's just kind of out there as a story, but don't let it be a barrier. It's amazing. And if you don't like blood, become a psychiatrist or a radiologist and look at x-rays all day. All right, we're at 3 o'clock. I do want to kind of respect people's time. I'm happy to stay here and answer questions and go through this. Where are we at? Goldie, Catherine, what do we do now?
I think so we're at 3, and if there's still any more questions, just put it in the chat. And if the students, well, because they need to go back home.
Yes.
Yeah, so and if there's any more questions, we can continue recording if Dr. Jensen has more time to answer, and then we will have the recording too, and we'll post it on YouTube.
Okay, and then Julia also put her email in here, so you can contact her as well if you have questions. Any more questions, guys? Really been great to have you spend your time and listen. Thank you for tolerating us.
Thank you so much. That's of good information.
Julie, any closing words?
No, just that I think medicine is great. And I think that there's so many things that we can do in medicine, that anyone can do in medicine. And if you guys have questions, reach out. I know that it can sound like it's a long road, but we still live while learning. We're like lifelong learners. So I think I love it. I think it's great. But yeah, reach out if you have questions.
All right, so looks like everybody's saying thank you. We'll stop the recording now. And